Which vein is most commonly used for routine venipuncture? A. Basilic vein. B. Median cubital vein. C. Dorsal hand vein. D. Subclavian vein. Answer, B. The median cubital vein is the vein of choice because it is large, stable, and located superficially in the antecubital fossa. It minimizes the risk of injury to underlying nerves or arteries compared to the basilic vein and is less painful than using small hand veins. What is the maximum recommended time for leaving a tourniquet in place during venipuncture? A. 1 minute. B. 2 minutes. C. 3 minutes. D. 30 seconds. Answer, A. The tourniquet should be left on for no longer than 1 minute to prevent discomfort, tissue damage, and inaccurate test results. Which angle of needle insertion is recommended for venipuncture in the antecubital fossa? A. 45 degrees. B. 30 degrees. C. 10 degrees. D. 5 degrees. Answer, B. The recommended needle insertion angle for venipuncture in the antecubital fossa is around 30 degrees because this angle allows smooth entry into the vein with minimal trauma and reduces the risk of puncturing through the vein. What is the first step before inserting the venipuncture needle? A. Clean the site with iodine. B. Verify patient identification. C. Tie the tourniquet. D. Select a needle gauge. Answer, B. Verifying patient identity before venipuncture ensures the right patient is tested, preventing errors and ensuring safe, accurate results. What is the most appropriate gauge needle for routine adult venipuncture? A. 25 gauge. B. 21 gauge. C. 18 gauge. D. 27 gauge. Answer, B. A 21 gauge needle is the most common for routine adult venipuncture. It is wide enough to allow smooth blood flow without causing hemolysis but not too large to damage the vein. Smaller gauges, like 25 to 27, are typically used for pediatric or fragile veins. When performing venipuncture, why is it important to anchor the vein? A. To reduce hemolysis. B. To prevent vein rolling. C. To increase blood flow. D. To avoid hematoma. Answer, B. Anchoring the vein prevents it from moving during needle insertion, making the blood draw easier and less painful. Which additive tube should be collected first in the order of draw? A. SST, serum separator tube. B. EDTA tube. C. Blood culture bottles. D. Citrate tube. Answer, C. Blood culture bottles are collected first to ensure sterility and avoid contamination with additives from other tubes. The correct order of draw prevents cross-contamination that could alter laboratory test results, ensuring diagnostic accuracy. What is the most likely cause of hemolysis during venipuncture? A. Using a 21 gauge needle. B. Shaking the tube vigorously. C. Proper mixing of tubes. D. Allowing the alcohol to dry. Answer, B. Vigorous shaking of tubes can rupture red blood cells, leading to hemolysis and compromised samples. Gentle inversion is recommended to mix blood with additives. Using the correct gauge needle and letting the alcohol dry also help avoid hemolysis. Why should blood not be drawn from the arm of a patient within 4 running? A. Risk of infection. B. Risk of hemolysis. C. Risk of dilution with 4 fluid. D. Risk of vein collapse. Answer, C. Drawing blood from the same arm as an active 4 line may result in a diluted specimen due to infusion fluids, leading to inaccurate test results. If necessary, blood should be drawn from the opposite arm, or below the 4 site after it has been paused. Which vein is most commonly used for venipuncture due to its accessibility and low risk of complications? A. Basilic vein. B. Cephalic vein. C. Median cubital vein. D. Radial vein. Answer, C. The median cubital vein is the preferred site for venipuncture because it is large, well anchored, and has a lower risk of accidental arterial puncture or nerve injury compared to the basilic vein. What is the maximum recommended time a tourniquet should be applied during venipuncture? A. 30 seconds. B. 1 minute. C. 2 minutes. D. 5 minutes. Answer, B. A tourniquet should not be applied for more than 1 minute. Prolonged application causes hemoconcentration, falsely elevating levels of analytes such as potassium and proteins, and may also cause discomfort to the patient. Which of the following steps should be done immediately after removing the needle from the vein? A. Dispose of the needle in a sharps container. B. Label the specimen tube. C. Apply firm pressure with gauze over the puncture site. D. Invert the collection tube. Answer, C. The first priority after removing the needle is to apply pressure with gauze to stop bleeding and prevent hematoma. Needle disposal and tube labeling come right after ensuring patient safety. Which of these is considered a venipuncture complication? A. Polycythemia. B. Hematoma. C. Hypoglycemia. D. Leukocytosis. Answer, B. A hematoma is a common complication of venipuncture, caused when blood leaks into surrounding tissues due to improper needle insertion, poor vein anchoring, or insufficient pressure after withdrawal. What is the angle of insertion for a venipuncture needle in the antecubital fossa? A. 10 to 15 degrees. B. 15 to 30 degrees. C. 30 to 45 degrees. D. 5 to 10 degrees. Answer, B. The correct angle is 15 to 30 degrees with the bevel facing up. This allows smooth entry into the vein while minimizing risk of going through the vein or puncturing deeper structures. Which needle gauge is most commonly used for routine venipuncture in adults? A. 18 gauge. B. 21 gauge. C. 23 gauge. D. 25 gauge. Answer, B. The 21 gauge needle is standard for adult venipuncture. It provides good blood flow and minimizes hemolysis, while finer gauges, like 23, are reserved for fragile veins in pediatrics or geriatrics. What should a phlebotomist do if blood stops flowing into the tube during collection? A. Remove the needle immediately. B. Re-anchor the vein and adjust the needle slightly. C. Switch to the other arm right away. D. Apply a new tourniquet above the site. Answer, B. When blood flow stops, the phlebotomist should slightly adjust the needle or re-anchor the vein. Sudden removal or switching arms may not be necessary unless unsuccessful after adjustments. What is the proper order of draw when using evacuated tubes for venipuncture? A. Red, blue, lavender, green. B. Blue, red, green, lavender. C. Lavender, red, blue, green. D. Green, lavender, red, blue. Answer, B. The order of draw prevents cross-contamination of additives, blood culture, blue, citrate, red, serum, green, heparin, lavender, EDTA, gray, fluoride/oxalate. What action should be taken if a patient reports sharp, shooting pain during venipuncture? A. Continue and collect quickly. B. Withdraw the needle immediately. C. Reinsert deeper into the vein. D. Apply a second tourniquet. Answer, B. Sharp pain may indicate nerve involvement. The needle should be removed immediately to prevent permanent nerve injury, and the procedure should be restarted at a different site. What is the main purpose of inverting collection tubes after venipuncture? A. To mix blood with additives. B. To separate serum from plasma. C. To prevent clotting in serum tubes. D. To remove air bubbles. Answer, A. Tubes must be gently inverted the correct number of times to mix blood with additives, e.g., anticoagulants. Shaking causes hemolysis, while failure to invert causes clotting or rejection of the specimen. Which vein should be avoided for venipuncture due to proximity to major arteries and nerves? A. Cephalic vein. B. Basilic vein. C. Median cubital vein. D. Dorsal hand vein. Answer, B. The basilic vein is near the brachial artery and median nerve, increasing the risk of injury. It is only used when other veins are inaccessible. What is the correct action if blood spurts into the collection tube under high pressure? A. Withdraw slightly and continue. B. Suspect arterial puncture and stop immediately. C. Tighten the tourniquet. D. Switch to a smaller gauge needle. Answer, B. Spurting blood usually indicates an arterial puncture. The procedure must be stopped, pressure applied for at least 5 minutes, and the patient monitored. What type of needle system is safest for small, fragile veins? A. Syringe system. B. Butterfly, winged infusion set. C. Evacuated tube system. D. For catheter. Answer, B. A butterfly needle allows better control with fragile or superficial veins, reducing vein collapse risk. It is often used in pediatrics, geriatrics, and dorsal hand veins. Which action helps prevent hemolysis during venipuncture? A. Using a large syringe plunger. B. Forcing blood into tubes. C. Allowing alcohol to dry before puncture. D. Shaking tubes vigorously. Answer, C. Allowing alcohol to dry prevents hemolysis and patient discomfort. Forcing blood into tubes or shaking them increases hemolysis risk, compromising results. What should be done if a hematoma begins forming during venipuncture? A. Continue drawing until the tube is filled. B. Release the tourniquet and withdraw the needle. C. Press harder on the needle. D. Switch to a smaller tube. Answer, B. If a hematoma develops, the tourniquet should be released and the needle withdrawn immediately, followed by applying firm pressure to prevent further blood leakage. Which vein is most appropriate for venipuncture in obese patients when the antecubital veins are not palpable? A. Radial vein. B. Dorsal hand vein. C. Cephalic vein. D. Femoral vein. Answer, C. The cephalic vein is usually more superficial and remains accessible in obese patients when other veins are hard to locate.